Before we do that, will you help us understand your background? But specifically, Mark, I'm going to have you talk about the background in terms of the context, or in the context of the evolution of your care when you first started in physiotherapy and you started becoming aware of certain classification systems and manipulative therapy back in the day, and how has it evolved in regards to the disabled chronic pain patient?
Okay. Well, that's now, I went into private practice on my own account by myself in 1971. So we're now talking exactly 50 years ago since I've actually been in private practice on my own account. Yes. So there's an awful lot has changed in that time. When I first went into private practice, you received, and also at hospitals too, but I did practice for a short period at the hospital. But I did, all of the patients had to be referred by a medical practitioner. Mm-hmm. And their referrals were pretty much the same. They're all a symptom like back pain or something, neck pain or whatever. And the instructions were shortwave diathermy and physiotherapy, or physiotherapy, including shortwave diathermy and or massage every day for 6 weeks, please. So this idea that, that over-treatment is new, or it was normal to treat people for 6 weeks daily. That was the way it was done. So, I actually took over the practice of a guy who was considered to be quite forward-thinking in his time. He was involved in the early days of IFOMT, and he went off to do a master's degree in economics back to the UK to do that after I took over his practice, because he had osteoarthritic hips. He couldn't continue to practice. That's how I got into practice. And so his name was Leonard Ring. And anyway, so the point is that he was also did a massage with patients, and he did ultrasound to backs, and he did shortwave diathermy with everybody, and he used a traction apparatus, and he would, and very occasionally do a good old golden roll manipulation on the low back. And, and a few things like that. So, and so I just took over doing exactly what he did, because that was the business. And so that's what I did. I quickly learned that, in fact, I even had my very first appointment book. And on that first appointment book, there was one patient in there. His name was, I know his name, but and he was a workers' compensation case. And he came in, he took 5 minutes to get from my front door to the bed. He took another 30 seconds or a minute to finally struggle up onto the bed. My predecessor had tried every treatment he had, his arm and his kit bag, and everything made him worse. The only thing that made him better was a bit of shortwave diathermy. And so I would treat him 6 days a week with shortwave diathermy. So he was my first exposure to the chronic pain, the malingerer. He was a malingerer. There's no argument about that. But he had to. He kept on coming to me until his case was settled in court. And I saw him on the street about a month. He'd been coming in for treatment for like 2 years, and every day. And I saw him a month after his court case, and he was walking down the street fine, swinging his cane. But he was on 2 crutches before I saw him, before his court case. So that was my first experience of the previous system that we had prior to our current system, which I won't go into in any detail.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.